All right, everybody, welcome back to the Friday. It's usually the Friday night prepper pre-party show. Today we're doing it live in the afternoon. I know this is not my normal time schedule, so anybody that's tuning in, I sure do appreciate you. This will, of course, take place to replace the Friday night prepper pre-party show, so I will not be live tonight. Please make sure you check out Bacon's live stream later on tonight. He usually goes live I think around 10 or so Pacific time. So he's kind of on the West Coast for all you West Coast folks. So as a reminder, please be kind to all the moderators and my guests. They give their time freely. If you want to throw any shade, you can throw it at me. I can take it. You can throw that either in chat or in the comments. And if you enjoy what you see today, please consider giving a thumbs up. If you're new to the channel and you enjoy the content, if you get anything out of it, please consider subscribing. So I'm going to get right into it today. So my guest today has really done a solid for the preparedness community and has solved a problem that has been, in chatter in the forums for as long as I can remember, as long as social media has existed. I know people have been talking about, like, what are people going to do for medications if we have some type of really bad scenario where people could not just go to the pharmacies and get their meds anymore. And the answer to that really is that we have to plan ahead, right? You can't think about it retroactively. You have to think of it proactively. And that's what my guest here has done. So I'm happy to introduce the CEO and founder of Jase Medical, Dr. Shawn Rowland. How are you doing today?
Hey, I'm doing really well. Thanks for having me on.
Thanks for coming on. And did I pronounce it right? Is it Rowland?
You did. Yep.
All right. Awesome. So just to get right into it, Jase Medical has really been a game changer for the preparedness community, a blessing for the preparedness community. Like, nobody else was doing this, right? Like, everybody was talking about, well, what should we do? What should we do? Stockpile if you can, that kind of thing. What led you to develop this, and what's the mission?
Great. Well, just quickly, the mission, kind of, the one-liner is that at Jase Medical, we are on a mission to help everyone be better prepared medically, to empower people to be better prepared medically. And really the how that came about, and really because we're, I guess when these kinds of shifts and everyone's thinking about their preparedness and things in the world are such that I think there's just a lot of timing that's involved here that happens to it just all comes together. And so for me, because the reason that how we're able to do this is really through a combination of technology and yes, some forward thinking, which is just kind of has to be that way because of the times we're in. And what I mean by that is, so this goes back to pre-COVID days. I'm working in a community hospital. I'm a family medicine physician, and at the time working in a community hospital, working throughout the hospital in the ICU and the emergency department. And routinely we would have shortages that we were dealing with. The ones that stand out to me were the two biggest ones were a particular IV antibiotic that is kind of the go-to that we use for when people come in really sick. And then sometimes things as simple as certain formulations of just normal saline for IVs. And at the time, it just really struck me as how could this be? How am I in the United States in today's day and age without access to these things? Again, remember pre-COVID, not just this kind of stuff just wasn't. We could get what we wanted when we wanted it. There were no shortages really, and so that was the thing. Fast forward through COVID, and of course things got much worse across the board with all kinds of shortages. And by then, I had learned that in the United States, we have no production capacity when it comes to our pharmaceutical supply chain. Certainly when it comes to the things that are most commonly used in the United States. We still produce, we still have the ability to produce some of the really expensive designer medications that are still branded and have their patents. But when it comes to 95% of what we take on a daily basis, it's all produced overseas. And so, of course, COVID exacerbated all that. But what COVID also did was it kind of put into fast forward the adoption of telemedicine as a viable means of delivering healthcare, not just from a regulatory standpoint, which it did, it did a lot there, but also from a public perception standpoint, just the adoption of it. People had to use it, and so they became more used to it, and in some cases really preferred it. So those two things really, the telemedicine aspect of it, and then just knowing the need there because of our shortages. And it's not just a shortage, it turns out, as we've been doing this for a while, right? There's natural disasters. There's even, in fact, probably some of the more common stories that we get are people who, a mom or someone who's, it's the weekend, for whatever reason, they have a hard time getting in to see their regular doctor, or dentist, whatever the case may be. And having the convenience of these meds on hand is a game changer for them.
Yeah, absolutely. And as somebody else who works in the field from the therapy standpoint, from the psychotherapy standpoint, we saw some of that stuff when the pandemic started with all of a sudden, we realized like, hey, where are all the gloves? Where's Purell?
Exactly.
Why can't we get hand sanitizer? Like, what is happening here? And that happened pretty quickly.
And
And
it's not just us, right? I think that's the other little, just to add a little fuel to the fire. It's the entire world. So, down in Australia, they're also dependent on China and some of these other places for their PPE and for their medications. And it turns out that's pretty much everyone else in the world. So when there is just a disruption of any kind, it's this downstream effect, affects everybody, and it just chain reaction, and then we're in line with everyone else asking them for our life-saving medications. It's a little bit crazy.
Yeah, and as we saw with the toilet paper thing, all it takes is a little hint of a shortage,
Yep.
and all of a sudden everybody panics, and it goes into now you can't find it anywhere.
Yep, absolutely.
Well, and having emergency antibiotics on hand during a crisis is critical, right? Especially if we already know that there's supply chain issues going on. My personal feeling is that every household should be thinking about this in advance, preparing for this. And this is how things really got started with Jase, right? Was the emergency antibiotics.
Yeah, exactly. And so that mission, back to the mission of empowering people to be better prepared medically, that's a big lift. That's a big ask. And the reason is because, medical preparedness is in some senses very individualized, depending on your particular health situation and needs. But there are other things that are kind of generally applicable, and antibiotics is one of those that is generally applicable. Everyone should have some amount of antibiotics on hand, the same as you have your Tylenol, your ibuprofen, just those basic things that you go to the store and have in your kit for first aid, or even just in your medicine cabinet. Same thing should be said for antibiotics. Now, yes, there are some considerations there with allergies, maybe an interaction with the medication you're taking. And so that's why we can't just go into your grocery store and grab some antibiotics off the shelf, to say nothing about antibiotic resistance and using them inappropriately. So there's all those components to it. So if we can find a way to educate people, to support them in the proper use, then yes, this is something I agree with you. It absolutely should be on in everyone's medicine cabinet. You should learn what it is that you have, learn how to take it and when to take it. And there's just so many scenarios. We've heard so many stories where this has been a game changer for people.
Yeah. And the Jase case is a good way to go with that. I've got a link for that in the description if you're watching this on replay or if you're watching in chat right now. By the way, hello to chat. I see everybody kind of popping in and out. Thank you so much. Road Preparedness is also a big fan of Jase, one of your other affiliates.
Yep.
Can you talk a little bit about the Jase case? Like what went into choosing those 5 antibiotics that people get if they purchase the Jase case?
Sure. So one of the things, as I was researching first, okay, how can we do this? What's the telemedicine process look like? And okay, I would love, if when it's appropriate, as far as the medications are concerned, give everyone a little bit of everything to have, as much coverage as possible. Now there's safety considerations there. And then there's also cost considerations. So basically the approach was, what are in a scenario where you didn't have access to healthcare for whatever reason. Maybe you're in the middle of nowhere in a rural area. Maybe there's a pandemic and the health system's overrun, and your doctor's office has been shut down, and getting into a hospital, you're waiting for days to be seen by somebody. Any number of things, right? So what are the most common bacterial illnesses that would be an issue in that scenario. Now in a really bad scenario, you'd have things come back that we haven't dealt with for a long time. Things like cholera, for example, if you had access to bad water because of a flood, or things as simple as a cut would get infected and turn septic. So what are the things we would want to look out for in those scenarios? And then lastly, what are some of the most deadly bacterial illnesses? And that's specifically bioterror is what we're talking about there. And in bioterror, the agents that have been identified by the government are treatable with the right antibiotic. And so that's kind of the background of how we came to these 5 antibiotics is what we ultimately came up with. It's 5 antibiotics that will treat things as common as a urinary tract infection, sinusitis, pneumonia, bites and bite wounds from animals, from humans, skin infections, and the list goes on and on. But then would also treat things like aerosolized anthrax, plague, tularemia. And so those 5 antibiotics you've got in the kit, the brand name of the medication is Augmentin. That is a medication that is basically, it's composed of amoxicillin and clavulanate. So that's one. The other is azithromycin. That's the Z-Pak that most people have heard of. Then you've got ciprofloxacin, doxycycline, and then the last one is a medication called metronidazole, and that would be for things like giardia. I mean, there's a list of other things on there, but some of these medications can cause something called C. diff, which is an overgrowth of this toxic bacteria in your in your gut, and can be treated by metronidazole as well. There's some other things that it treats as well. So those are the 5 that consist. That's what makes up the Jase case.
And for the viewers who haven't purchased one yet, you also get a little booklet with it that explains what these all are.
Yes, absolutely should explain that a little bit, because we do get, I think overall the reception has been just overwhelmingly positive. If we do have people who are maybe giving it a little bit of a sideways look, they'll typically complain about cost, for example. And I think what those people fail to take into account is that this isn't just, you're not just walking in and taking these meds, off the shelf and going home. You're having the doctor visit. So you come to the website, you fill out the form, the doctor reviews the answers. This is a board certified physician who is looking at the medications you're taking, looking at any history of allergies, looking at making sure that your kidneys, your liver are working properly. So they're actually reviewing this and then writing a prescription for each of these medications and sending that to the pharmacy. So there's that component of it. To do the same, right? You'd maybe schedule something with your primary doc, get in 2, 3, 4, 5 weeks later, depending on where you're at. And then have that encounter with him where you're going to explain, hey doc, I'm looking for these 5 antibiotics. I'm not sick right now, but I want to have them just in case. Yeah. Now we might get to a point down the road as this becomes more and more of a thing and is just more accepted, that visit might go well. I think still, though, we're at a point where some doctors would be a little hesitant. They've never worked outside the insurance system because this would not be covered by your insurance, by the way. And so they're not sure how to go about this and how to do it. So there's the physician component. You then go to the pharmacy where you're going to be paying retail rates at whatever pharmacy your prescriptions go to. Now we've spent a lot of time negotiating some, the volume that we're doing and with our partner pharmacies, and getting some savings to pass on to our patients. And then lastly is, okay, now you've got these medications, what are you going to do with them? So we've also invested a lot of time to put together, for me as a family physician, one of my top priorities is it's education. It's going through with my patients the whys and the hows behind what we're doing. And so we tried to do that as well with this. So you get a little booklet. It's our emergency antibiotic guide. It explains in layman's terms, okay, if these are your symptoms, this is the right medication and this is how long to take it. Now this should be kind of your last resort. We have kind of a tiered approach there. First, you should be talking to a healthcare professional if you can. If you can't get a hold of anyone, then you've got this resource. There's other resources out there that you could also use. This is the one that we include. And then we also basically allow the patient to contact us anytime. If you've got a question about what you've been prescribed or some interaction with the medication, you can contact us. That message will go to either our staff physicians or that are here 24/7, or we'll forward it on to the physician that reviewed your case when you went through the encounter. So that's additional support. It goes on forever, and you can use it whenever you want. All those things bundled together, when you take all that into consideration, that $259 price point is pretty remarkable.
Yeah, absolutely. And you mentioned the team of people that work there. I know you and I were talking backstage before we went live here, but I just want to reiterate that the team at Jase, everybody that I've interacted with as a brand affiliate, have just been phenomenal. Like the Joy is the person that most of the brand ambassadors work with, and she's just on the ball. Like every question I have, she gets back so quick. Jane, who does your Instagram reels, just does such a great job. And when I did my own Jase case, when I was, applying for it, it was just like really, really quick, shipped out super quick, super impressive. You've done a great job of recruiting really good talent.
Thank you. Yeah, that's great to hear. That I really appreciate that. I think that's another thing, just to let people know. Yeah, we're not a Walmart. We're not a big corporation. We've been doing this for a few years now, but we're small. We're a small bootstrap startup. Really pride ourselves in that customer service. We're not perfect. There's a lot of things to connect here, from patient to doctor to pharmacy, fulfillment. And so when things don't go perfectly smooth, we pride ourselves on that back end, where you've got a human being, a lot, always there's human beings involved all through this process, but who are there willing to bend over backwards to make things right. And for the most part, we have great reviews and ratings. People are concerned. This is their health information. They're concerned about privacy. Some of them might have time considerations. Maybe they're going on a trip and they want to get this thing in time. And so overall, the response is, just like I said, been very positive. So it's good to hear that feedback from you.
I'm glad to give it. And Digital Preppers here as well, another one of your brand ambassadors, and he had a cool question here. Let's see. Would you? Oh yeah, and this is an email that I saw this week. This is a good talking point, I think. What about not having just one kit for the family, for people that are in a position to be able to do so? It's probably not a bad idea, right? To think about. Is it 12 and up? I think anyone who's 12 and up.
Correct. So yes, the Jase case is for adults. We do go down to the age 12, who are basically treated from a dosage perspective as adults, and so that's where that age cutoff comes in. Below that, we have to start weight-based dosing. Maybe they don't swallow pills and they need a suspension of a liquid suspension, and we are hopefully not in the not too distant future. We'll have solutions for that as well. The other thing to consider is, do you have maybe your place of work, maybe your cabin out in the woods, maybe your boat, whatever the case may be. And that's something that we've worked, initially we wanted to just be super, super careful and do this as good as we could with the physicians all on board. We limited it to one case per adult per year. We've since been able to institute some safety protocols and get everyone on board, and now you're able to get a second kit, a third kit, as long as the physician feels comfortable with where it's being stored. And so that is also, so if you're one of the listeners who's already got a Jase case, and you've wanted to have another one, that's a possibility now.
Awesome. Well, that's really cool news. And then the other big cool news that's come out fairly recently was Jase Daily. So it's not just about antibiotics now, right?
Yes. Yeah. Thanks for that. Jase Daily was back to the mission, being empowered to be better prepared medically. It's not just antibiotics, obviously. There's a lot more. There's and we'll get into that, but antifungals, antivirals, there's topical medication. There's a lot, right? But you've also got people who have high blood pressure, who have diabetes, who have thyroid disorders, seizure disorders, anxiety or depression, any of those chronic medical conditions where you're taking a medication on a daily basis. Same thing. All those medications all of them are made outside the US. and almost all of them you could eventually trace some component of it back to China. And so the access is and the possibility for disruption is just as high in those medications. And so Jase Daily, as we approached that was something that we knew from day one. We needed to do the same thing, but it's so much more complicated. When you look at giving someone a pack of 5 antibiotics, it's basically the same for everyone minus 1 or 2 due to allergies, but you can plan for that. You can package it all up nice, provide the book, and that's, which is why we chose that first. It was what everybody needed. It was generally applicable, and it was something that we could plan for. Now, Jase Daily, we went from those 5 medications in the antibiotics in the Jase case to around 800 medications for Jase Daily.
Wow.
All kinds of, so again, I mentioned those conditions, but those are the conditions we're trying to cover for. And what we offer is up to a year's supply of that daily medication. It's probably easier to talk about what's not on the list because it is a long list, but what we don't cover is anything that's a controlled substance. So pain medications, of course, are not on the list. Medications for ADD or ADHD are not on the list. And then some medications that require frequent monitoring because you have to check levels in the blood. There's some blood thinners that would be on that list. Some psych meds or seizure medications. But everything else we cover, your SSRIs for depression are on there. And these are important to know because now there's some medications, if you were to all of a sudden go cold turkey because you didn't have access to your statin for your cholesterol, you're probably going to be okay. You can wait a little bit of time and get back on it. Doesn't mean that you shouldn't have it on hand. If you can, why not? But there's other medications that you shouldn't go cold turkey on that could have some very serious consequences. The Prozacs and those other antidepressant medications are on that list. So for those folks, I mean, this is just this. We had such an outcry, and so we really did what we could to get this out as fast as we could, but it still took a while. But we now have the Jase Daily. Not everything's on there. So what we tell it, go to the website, you can start that Jase Daily encounter. And at the very beginning, it'll ask you, you start typing in your meds. It'll tell you, number 1, if we have it, and number 2, how much it's going to cost. And if we don't have it, there's a space there to say, hey, this is the medication not on your list. I'd love if you, and we're adding to that list every day. So that's the Jase Daily service.
That's fantastic. Sometimes I have people in my audience who say, I have a family member with a pretty serious mental illness, talking about like schizophrenia or schizoaffective and things like that. Do you all do antipsychotics yet too? Is that one of the things that's on the list?
Some of them are, yes. There are some on there. Now we also don't have that you remind me of things like, like Haldol for schizophrenia. It's in many cases, it doesn't have to be, but it's an injectable medication. Right. And so we don't right now. It's pills and tablets and capsules. We are working. I think we're really close to being able to handle non-orals, so topical things, maybe things that you only take intermittently, and the injectables.
That's fantastic. And you mentioned the Prozac, all of the being somebody that works in the field of mental health, all the SSRIs. I know that they get a bad rap sometimes in the news. My experience, having been in the field of mental health for over 25 years, is usually when there's a bad outcome with that, it's because somebody wasn't taking it consistently, and it does some wonky things with your mood if you miss a few doses. So
exactly.
Completely agree with what you said. Like, you can't just stop one of those medications. There's protocols that doctors have to follow to help a patient safely taper down if they want to come off of these meds.
Yeah, exactly. Yeah, that's. I mean, I think that, and it just this whole thing gets back to having that peace of mind. If you're someone who's dealing already with anxiety and depression, and you come to find out that it would just take nothing really to disrupt from where this med's produced over in China and then transported and shipped across and makes its way to the pharmacy and all the things in between that could cause a problem. And we have seen it. And that's the other thing, that I was dealing with some of these shortages pre-COVID, but man, look at the last year. We had baby formula, we had children's amoxicillin, children's Tylenol, and then things that we don't hear about. There's blood pressure medications that are routinely go in and out of shortage. I mean, it's across the board. There's cancer medications right now that have been for years in a chronic shortage, to the degree that doctors are having to choose who gets treatment for cancer. And all this is to say that the problem is not getting better. It has gotten worse, and it will continue to get worse. We have a saying here that, which is not ours, but it's not if, it's when. And with these medications, I'm not a salesman. I'm a physician first and foremost. That's how my brain works. I'm not good at being salesy, as many of my sales team can attest. And so when I say things like that, I mean, that's truly what I believe, and it's what I've experienced, that it is not if, it's when. And so for someone with anxiety and depression, who understands all of this, and just lives in fear, of all kinds of things, but also of not having access to their medications, this is a no-brainer. This person, as long as they meet the criteria, they've got follow-up with a doctor, it's an established condition, it's not newly diagnosed, they've been taking this med before, they haven't had to adjust dosage, someone who's stable, then absolutely, as any primary care physician or any physician would see that and say, yes, I'm okay giving you a year supply. The reason I don't is because I live in the insurance world. The insurance won't pay for that. At most, they'll pay for a 90-day supply. And it's living in this other world. They're just not equipped, and the system isn't built to do this kind of thing. And then to have you go and pay retail cost for that is probably going to be cost prohibitive. But you'd be shocked to see, go pull up your med, go to our system, pull it up, and see what a year's supply of your blood pressure medication costs. It's going to be $40 or something, and other meds are going to be more. There's a big variability. There's a wide range there. But at the end of the day, it's not cost prohibitive. This is affordable, and it is something that everyone should take advantage of.
Yeah, Celine, I saw your question. I'm going to come back to you in just a second. I did, as you were talking about that, we've, in the mental health team that I interact with, we've encountered some shortages and things like that for some of our patients, and try to problem solve around those things. And there's a lot of frustration when you can't fill your medications. I've actually encountered that myself with my asthma a couple times, where the medicine wasn't available. Fortunately, being a prepper, I always have a little bit stockpiled.
That's another one. I mean, asthma is it's your albuterol inhaler. You should have 10 of them, and they should be everywhere. Yeah. But again, insurance gets involved there, and maybe even your physician. But yes, there's some of those are just, our system is a little bit crazy with some of that stuff. We need to figure that out.
Yeah, and the patients, will often ask me, well, why is this happening? And I explain the supply chain thing, and the medications might be coming from China or India or South Africa. And they say, well, why did this happen? I said, well, that's complicated. We probably have to go back to at least the 90s, when all these companies were downsizing and moving stuff outside the country. Yeah. And to move some of these pharmaceutical production back into the United States is not that easy. There's a lot of red tape to starting something like that back up.
There really, though, I mean, the quick answer is follow the money. That's really for almost any issue. Follow the money. And there was a concerted effort, certainly by China and other countries, but China principally, to draw that business out and to own this market. They don't own I'm not talking about just prescriptions. They own any vitamin C you've ever taken. That active ingredient is almost assuredly from China. Even your Whole Foods, all natural. I mean, it's still coming from China. That was very purposeful. So when that last plant closed down, I want to say it was 2014, that was making penicillin here in the US, and they moved everything overseas. It was a financial decision for the bottom line of the company. And now we've created this. It's a national security issue. It's the health of our population, and I would hope, and there have been some steps taken by the government. Although I would say they talk about this every year it comes up. So somebody points it out, and they throw up, oh my gosh, and they wring their hands. What are we going to do? and nothing gets done. Most recently, though, a couple months ago, they did actually provide some tools, some funding in order to help to encourage bringing some of this stuff back. But you're right, there's regulations to consider, obviously the financials of it. It's not, and when you're talking about antibiotics as well, you don't just throw up a plant and start making medication. The process to get the raw ingredients, there's a fermentation process. It's very complicated. It takes a long, it would take years to build up a facility, which, yes, let's do it. If it's going to take years, let's do it right now. That's something behind the scenes we're kind of working on, but doesn't help you today. Today, you need these medications in your hands.
Right. Somebody in my audience asked about oral contraceptives, birth control. Is that something that's available too for your supply?
Ooh, that's a great question. I know we talked about it. It's been a while since I looked at our list, and we're adding every day. So I would just encourage them to go to the website and type in the specific one. And if it's not, it should be. And so let us know in that process. You can let us know, and then we can get it added. But that's a good one, and then they should be on there. And I would have to, if I had to just guess one way or the other, I'd say yes. But again, verify that, check in on the website.
Okay. Yeah, that's one of those things in the preparedness community too. It doesn't get brought up that often, but every once in a while, somebody will say, yeah, you should be stockpiling some birth control too.
Absolutely. Yep. Yeah, it's a great point.
You mentioned privacy before. How does Jase protect people's privacy? Like, so I went on, I did my online screening, ordered my Jase case. What happens with all that information?
Yeah. So there's kind of, everyone's heard of HIPAA. Those are the regulations that anyone who deals with protected information, like your health information, are expected to comply with. And so we've built our system to be totally compliant with that, meaning there's multiple layers of security, and encryption in any data that gets entered in on the site. Now there's a flip side to that, and that is when it comes to communicating with your physician, for example, when it comes to us communicating information between the pharmacy, the doctor, all of that stuff is top of the industry encrypted. But that can also create some barriers when your doctor's just trying to talk to you. They need to ask you a question. And the easiest, people want there to be a nice, convenient way to do that. You might not be available right at the moment that your doctor needs to ask that question. So are you okay receiving a text? Are you okay receiving an email? And so a part of kind of our terms there in the encounter is to say, if we need to reach out to you, is it okay if we use things like text and email? That might not necessarily be at that same encryption level. And so there's kind of, but as far as how it's stored and transmitted, we're the same as whether you're dealing with your hospital, your clinic, anything like that.
Yeah. And there was, I'm not going to name the company, but Digital actually had made me aware of this. There was another online medical company that was actually selling customers' information to third parties, which is a big no-no in our world, right? We know that. And I just want to reassure the audience that that's not something Jase is doing.
Exactly. No, that's, I mean, it's so not, it's so out there for us that it's, I just like, really, like, no, that's, and no, we treat it the same as, I mean, I as a physician starting the company, and really very early on in the early days, I was the one, looking at these encounters and interacting with the patients, and treating it as if it were just an extension of my private practice. And so all those safety protocols and making sure that anyone who, whether it's a customer service agent, whether it's one of our programmers, that everyone abides by the same rules, is something that we take really serious.
All right, great. And then I'm about to hit my last question, y'all. So those of you who are here in the live chat, if you have any questions, now's the time, throw them up there, because we're going to be winding this one down. So my last question is, Jase Medical, we know it's available in the United States for United States residents and Canadian residents. Are you able to talk to us about what kind of things are coming in the future, or what you hope is coming in the future?
Sure. Yeah, I alluded to one of them. You brought up the U.S., Canada. We've been working to get into Australia, and from there, there's a number of other countries. I mentioned it early on in the conversation. We're not the only ones dealing with this. That was actually something for me. I know the U.S. healthcare system. I'm in it. I've familiar with it. Knew what the needs were and the deficiencies, and that's where my mind went this whole time. But as soon as we went to market, we just started getting flooded with emails from all over the world of people who had seen it and were dealing with the same thing in their country. And it just was a eye opener for me, because I didn't really, I thought, oh, well, this country has, universal health care and whatever. And just didn't see that they were dealing with the same issues. And so prioritizing that that's where we went to Canada first, and Australia, and we'll go from there. As far as services or products, what I mentioned before was, it's not just antibiotics. There are other medications. We can call them emergency use medications, and what I mean by that is they're not for a chronic condition that you would need to take on a regular basis. This is, something unexpected came up and you need access to this medication. Actually, albuterol you could put in that category. It kind of crosses boundaries. So it's a chronic condition, but also something that you only use in emergencies. Epinephrine pens for people who have anaphylaxis, allergies, but then other things like topical steroid creams, antifungals, antivirals, eye drops, ear drops, a whole list of other things. And so we've probably got another, the Jase case is 5, where we are going to basically expand on that. So you've got the Jase case, and then you can add on up to about 20 other medications that would be in this kind of emergency use scenario. That is our next, I guess, big thing. And I also alluded to the pediatric side of things, where we want to be able to provide access to the Jase case for pediatrics, which involves a parent or guardian understanding how to properly reconstitute a powdered medication and how to properly dose it. So there's some education component there. But I can tell you, and as a parent myself, I want to be prepared for myself, but because if I'm no good, if I'm sick, I'm no good to the people who depend on me. But when I think about my children, I'll do anything to make sure that they're safe and healthy. And so this is a priority as well. So those are 2 of the other things we have coming down the pipeline. There's more, but I think those are 2 that hopefully we'll see here in the not too distant future.
That's fantastic. I'm not seeing any more questions, so I'm going to start to wind this one down. And I want to say I really, really appreciate you coming on, and I love what you're doing. I really do. I'm so proud to be able to endorse Jase Medical. It is absolutely a fantastic service. If anybody's had any questions about it, you can certainly hit me up, but you don't have to. You can hit his staff up on their website. They are really quick to respond, and I've used it. I plan to continue using it for some other medication needs that we have for my household. And I really want to say thank you, because this is a problem that's been in the preparedness community for a long time. And it was your innovation. And I know there's some copycats out there now that are trying to jump on this, but it was your innovation that brought this to the community. So
thank you.
Yeah, great job. Really appreciate it.
You mentioned the competition, and yeah, but this goes, I'm not, at the end of the day, I want people to be prepared. And I've said this from day one, where I said, hey, you don't have to come to Jase Medical. At the time, we were the only ones. If you have a good relationship with your physician, and you can go do that, you feel more comfortable doing that, by all means, please do that, because I truly feel about the need for this. It's not a need for Jase to be wildly successful. It's a need for everyone to have some medical preparedness of this kind in their home. We have worked really hard to make it as painless, as cheap and accessible as possible. And I'm really proud in what we built. But at the end of the day, you just need to be prepared. And it's one of those things, I guess preparedness is like that with anything. And I would, that's something that we deal with, is just getting people, lighting that fire under them to tell them, today's the day to do this. It was amoxicillin a few months ago that you could not get.
Yeah.
It could be and this is, I'm not trying to fear monger. I'm not trying to just drum up, some fear here. It absolutely tomorrow could be whatever medication that you take on a daily basis, or could be whatever antibiotic that you're going to end up needing, because and we're talking about your life here. So use this service. It's really accessible. It's quick. It's really affordable. And at the end of the day, I appreciate you letting us come on to help get the word out. That's what it's all about, is getting the word out. If you've already got a case, you already used the service, then tell your neighbors, tell your family, tell everybody. And let's get everyone that this part of their preparedness, let's get it off their list and give them that peace of mind.
Yeah. I did have one more question here, if you don't mind.
Yeah.
Is there any possibility of adding some kind of payment plan in the future? Are you thinking about anything like that?
There is already. We work with, I want to say it's a firm. It might be Afterpay. I get the two confused all the time, but you'll see that when you go through the checkout process, and that basically you go through your information gets sent to this third party, who then handles the payment process. But that is something that we added quite a while ago. We had that request early on. So yeah, that is an option.
Awesome. Great job. Well, thank you again. Appreciate you, and appreciate the chat for tuning in with us, and all the great questions and comments out there. Anything on closing before I close this down?
No, just again, thank you for the opportunity, and yeah, as we get on new services and changes, happy to come back and talk again.
Let's do it. And if you're ever in my area, make sure you hit me up. We're going to grab that steak. All right.
Oh, wait, tell me again. Where was it?
I'm in Charleston, South Carolina.
Where was that? Your number one?
Hall's Chop House. I give them a little small business shout out. Yeah.
There you go. Okay, will do. All right. Thank you so much.
All right, everybody else out there, keep planting your seeds, keep stacking your silver. This is Dr. Shawn Rowland and Prepping with Sarge.